What does it take to save a joint? A finger joint, a knee joint, an ankle joint, a hip joint, a wrist joint. They all have the same kind of physiology. They've worn out ahead of their time. The other joints in your body are more okay than this one or two, and so now you've been told that your joint is bone on bone. I've already shown you, check out the videos. How do you know how difficult it's going to be to save your knee? How do you know how difficult it's going to be to save your hip? But when you go to do the process, the big deal is, can you balance wear and tear with your biologic ability to restore? There are orthopedic textbooks that say once your cartilage is worn out, you just can't do anything but replace the joint. And I started to wonder many years ago whether that was even possible to be true. I mean, look, you grow new skin every 7 to 10 days, you grow new fingernails, you grow new hair, you grow new brain cells and new heart cells. Does it make any sense that our biology can't repair cartilage from daily wear and tear? So the reason this joint wore out faster than the other ones is you have an injury to that cartilage sometime in your lifetime, maybe multiple injuries. And those injuries have injured the resilience of the cartilage, so it wears out faster in that joint than all the other joints from normal daily wear and tear. So, how can you correct that? Two things need to happen to balance this equation, or there's two places you can reach. One is to wear your cartilage out more slowly, and the other is to grow it more quickly than your body can do on its own. To wear it out more slowly, we teach you to take smaller steps. We teach you to use elevators and escalators. We teach you how to preserve the joint. And then, to grow cartilage more quickly, one of the things that becomes most important is you need to do something every single day that can help you grow cartilage more quickly. And for that, we rely on glucosamine. Well, glucosamine works for knees. Glucosamine by mouth works for knees as long as you have a brand that works. If you've been taking glucosamine for your knees and you have a brand that works and you don't think it's helping, it's not because the glucosamine isn't working, it's because your pain is not coming from your joint. The pain comes from the fascia and the tissue that holds the joint together and helps the joint to move. For your hip, oral glucosamine supplements, I've never seen them work. Not the hyaluronic acid, not anything. The thing that works best to help your body grow cartilage faster for a hip joint is glucosamine through your skin applied with a cream. And we've actually developed a cream that's prescribed in the pharmacy that you can use 3 or 4 times a day on most any joint in the body, and it will help that joint recover. Well, there you have it. That's what you have to do to help balance wear and tear with your body's ability to restore. And then, once you have that balanced, and you've proven that you can make that work, whatever you do at a point in time, you don't have to talk about how long till it wears out, because you're sustainable, possibly for your lifetime. And now we can talk about exosomes, peptides, platelet-rich plasma, and stem cells. I'm Dr. Hal Blatman, Blatman Health and Wellness Center, www.blatmanhealthandwellness.com. Look us up. Maybe we can help you. Have a nice day.